This is the earlier one by just maybe advising the accountant that this you are in good standing and you're active, you should not embarrass the governor because of small issues. And you have time with the auditors to resolve those particular issues so that it doesn't reach our level. Secondly, Chair, I wanted to find out from the governor, because this it is under their own law. And there is a law that we passed last year, the FIF, that says that each of the hospitals should have its own fund. And the chair was, during the preliminaries, we were saying, supposing you have 20 or 30 or so level 4 and level 5 hospitals, how practical is it to have that number of funds instead of consolidating? Now that we have seen Nandi have one, maybe we wanted to find out from the governor, how do you see what you are running currently, where you have one fund under all your hospitals, and what has been passed as a national law? So is there a conversation that you've started as a Council of Governors on the same?
Yeah, as maybe governors, you prepare to answer that question. Now auditors are now processing audit report for each individual hospital as an entity, as an accounting entity. So maybe you can explain to us how you intend to proceed with this FIF. Auditing each hospital as an independent entity. So now, how are you going to run this FIF, county FIF, the new arrangement of the law, and also what the auditor is doing by auditing each individual hospital?
Chair, you will the Parliament was considering this national FIF law. One of the concerns that we had raised as Council of counties already, and I think we were over 30 counties already that had FIF, county FIF laws. And therefore we had raised this matter, but once you responsibility of we in counties to just comply with the decision. Therefore, we are in the process of, FIF laws to agree with the national legislation that you passed. Operating in the same manner as prescribed by the FIF national legislation, because every entity is being audited on it, and they are able to plow the same resources or budget the same resources and expend at the facility. So for us, really, whereas hospital and all the level 4, we think that the approach or the law that was passed by this house is, and in any case, as you indicated, the OAG are auditing each entity on their own, so it makes a lot of sense for us. So we are actually sort of transitioning and operating within the national legislation that you, as Parliament, have passed, and it is working. In fact, it is.
Senator Tobiko.
Chair, thank you, Chair. Chair, I think the question by Senator Kisang, if I got it right, I think in terms of the audit, but in terms of the FIF can be done like collectively, so that any facility that's facing challenges, that is struggling, that is not self-sustaining, can be kind of cushioned by a facility that's doing well. I think that's where he's coming from.
I think it's a bit difficult to it would, and I'm just responding this from where I sit now. It's difficult to get resources from one facility and support another facility. For the staff, is still paying for the medical, the human resource. Therefore, really, you can't say that there is a facility that is actually generated. Are still in arrears, but there is huge improvement from what we had previously. You know, so if you look at what was happening under NHIF, is part of what I think we have also raised with the health committee. When you go to level 3 facilities, for them to be able to do the claim. So we still have those challenges in terms of that has not been fully achieved. So I think it is a huge improvement from where we are.
Yeah, but as a Council of Governors, what are you doing about that challenge? Because I think it's...
This is a matter that we have raised continuously. We are also having other national government programs around equipping, a model that was adopted. And so we also have some of pushing also, because they are also, their payment or payment of their services is based on the SHA you know, KEMS are also pushing. So I think there is a good number of government and pushing SHA to improve in terms of their submission of claims. The only thing that we have to private facilities in terms of payment of their claims, we must have because their infrastructure is largely already set up. They may be slightly ahead of us, but we have made the appeal to SHA that as much as, you know, we have to catch up as county public facilities, but they must ensure that priority is given to facilities that are actually serving a bigger population of Kenya. So we are pushing with all the other stakeholders on this, and we need your voice as the Senate, particularly your counterpart committee in health, to ensure that these improvements are sustained.
Maybe what I picked from the governor, I think it is maybe one of us or the health committee, we need to actually invite the CS Health to give us a status of what they promised, that 104 billion. So we need to know the actual status of the implementation in all the facilities.
Are suffering in hospitals. I had an issue in Machakos County where a patient was supposed to be transferred, and the hospital, a private hospital, could not release the patient because...
Chair, now that, I mean, just a follow-up as I throw the 4 legislations that you passed, it might be time now for you to evaluate the level of implementation. National government to help us with digitalization. It would be unfair to have an hospital with a gadget. Internet has not been equipped with equipment that are supposed to help you provide service. So that was captured. I think it was a program that was launched by national government. So I think so we must ensure that the 4 pieces of legislation that you approved in this house,
the members, we will proceed to the report on bursary.
Chair.
Yeah. Yes.
But I would want to ask a few questions because it's very critical and it's part of the documents.
Okay, just
that has been
just
provided.
A moment. I allow the auditor.
Chair, on budget, see from the, I'm following your report that that was submitted before this committee. Because Chair, you just moved away from FIF Act, which is used to that they provide at that level. So, Governor, the following questions, I can see there was an, or who deals with it? The revenue potential, the CRA revenue potential, number 1, at least that there is, you know, I am picking from what Senator Kisang, Senator Cpic, by the infamous CPA Julius Kimboy, there is 39 million, but you ended up collecting 155 million. In Nandi Hills, you collected at 1 million. That's a slight difference of 9 million. But you ended up collecting 5.4 million. In Kaptuma Sub-County Hospital, targeted 18.8 million, but you collected 7.4. Osoria Sub-County Hospital, your target was 7.8, ended up collecting 5.1. Cpic Sub-County Hospital, your target was 12.1, but you ended, according to the auditor report, this was a mid target of non-collection of 41%. I have seen the result. You are the one submitting this report. You allude to two reasons. Health workers strike, and hence there was no revenue. How many times did the nurses, and I remember when there was supposed to be industrial action, you are on record on several occasions that you have avoided by negotiating with the unions. Then why does it become a reason? Number two, you say there was delay in supply and delivery of medical commodities, especially drugs, to hospitals. But on record, you have always insisted that there is enough drugs in a hospital. So why contradicting statements, yet you are doing under collection? And now you yourself, you have said on record, if the facility does not collect as per the FIF Act, it might not end up to be sustainable. Those, that is my question one. Question number two, in Cpic, and let me pick Cpic and Cpic, Cpic, the newborn mother unit is up to now. So what is the implication of collection of this target that you are projecting? And number two, in Cpic, the project that you are doing is not yet complete or installed. Does it affect the projection of your revenue? That will be my question number two, Chair. Number three, I thought you have said, because I have seen your own source revenue reports, that the collection of revenue has been automated. Is it true that in facilities that I have mentioned from Nandi, Cpic, Kaptuma, Mosoriat, Cpic, Cpic, today have of collection of revenue? That will be my number three. And I hope, Governor, you are noting so that it is easy for you to answer. Let me finish with this, Chair. And I want to look at their documents which they are provided. Chair, this will be my final question, Governor, on the use of goods and services. I find it interesting in your expenses, which are necessary. For example, you in use and goods, that is note number 7 in your financial statements, and I hope your staff are kind enough to show you. That is page 19, note number 7 on your financial statements. You did general expenses of 2.1 million. You went ahead and did printing and stationery of 4.5 million. General office expenses, you or 2.1, I hope chair members are noting this, and then you go ahead and do printing and stationery at 4.5, and then you go ahead and do printing and stationery at 4.5 million. Then you go ahead and do computer accessories at 1. Then you go ahead and do computer accessories at 1.2 million. 0.2 million. So I assume people take chai and mandazi. With noting that in your financial 1 million on health celebrations, and then chair celebrations, and then chair that chair and I have noted another thing, Chair. And I hope members will bear with me. Subscription, no, sorry, that is okay. You are spending almost of water expenses 800,000. You are spending on airtime, telephone, and communication expenses of 40,000. But water, you are spending it at 800,000. Chair, you now have visited a number of facilities, including the latest at Combe Dispensary, and they have a challenge with water. So all this, Chair, I have told Governor in your unnecessary expenses, because renal supplies, medical cases, medical laboratory reagents, branding linen, which is understandable, the issue of fuel and oil transport, which is 2.6 million, fuel for production. I will need clarity, Governor, because that is why this clerical error came, by the way, because you are saying fuel and oil for transport, 2.6 billion. Then you say fuel for production, 815,000. So, Chair, I have total unnecessary expenses comes to around 12.8 to 13 million from general office expenses, catering, health celebrations, printing and stationery, computer accessories, telephone and communication expenses. And I have found an interesting thing, Chair. Governor, do you outsource consultant services because you have paid 776 people? Does it mean you have professional, does it mean Nandi County and your chief officer of health the professionals, and that is why you are outsourcing consultancy services, where you are paying in one financial year 776,000. So, Chair, you can look in unnecessary and unfortunate expenses. It comes to more than 13 million Kenya shillings, which comes to almost a half, or even almost a half of pharmaceutical supplies of 26 million. That is why the governor has argued that there is delay there is not an availability of drugs because he's spending it on unnecessary expenses. So my question, Governor, what is the justifiable reasoning of spending these 12 million in health celebrations, in general office expenses, in printing and stationery, in computer accessories, in airtime, in professional consultancy? And Makiu, I will assist by guiding you that when you talk about catering, there is already a provision of food and ratio, which I assume this is one is being supplied to the patients of 4.6. Even if you are to say doctors and nurses are consuming 3.4, they are almost consuming the same as the patients, yet the patients are much more. So that will be my third and final question, Chair. I yield the ground.
There are so many questions. I don't know whether, Governor, you are writing.
Write it down.
Chair, I think that, and maybe we just need guidance, analyzing budget was not an audit query. If we needed those details and the senator wants those details and the committee
Chair, on point of order, on Article 229(4), it says the Parliament shall consider.
Kindly allow me to talk. You have had your.
Chair, can I ask what?
Let the Governor respond.
Yeah.
And then I will give you a chance to.
Into a forum in this committee, we come specifically to address details of analyzing the, item. Yet there is a whole process of how a budget is arrived at. It's not a decision of the governor. The budget is not done by the governor. It is done by various institutions. Simply, and therefore, the details of those discussions of this one and this and this, if then the senator needs responses to each of those questions. But really, if you look at what we came, the audit queries, I might then require to have a whole team for us to discuss. So I think what the senator has raised, valid as they are, if you can be able to share with us in writing, we can be able to respond to all those issues. But really, it would be fair that we are able to deal with audit queries basis of what I was invited to come and respond to, than really to go on, on a mission that, again, I am able to respond on top of my. Yet we have a whole team and a whole process, and the budgets are done. I may even find when a budget is done, if you have concerns as a governor that maybe this should have been, that is why it is, we provide. It goes through public participation, it is amended, certain things are changed based on the input of the public and the county assembly, and therefore when the budget finally is approved, it may not be exactly what the governor had provided for. So really, let's just be fair so that it doesn't look like this budget is drawn exclusively by the governor. And if we want to have a discussion on the budget and the entire budget line by line, I think a better forum should then be availed so that then we can have that discussion. So Chair, to be responded.
I think what Senator Cherajai was doing, there were variances between what was budgeted. So what he was trying to analyze is actually the financial statement. Expenditure was varied from the budget because of the plans to respond.
Chair,
and then
I think you have captured partly what I asked: performance and control. And even I asked a basic question to the governor: do we need hiring of consultancy services? You should have said we don't have a gynecologist, for example, or oncologist, and say that's the reason we pay. It is a simple question. So, Governor, Chair, what can happen if the governor would want to respond on budget priority that are on his own financial statements, then the committee can write a letter to him. But my other questions the governor has avoided is even a simple question: revenue collection from Cpic all the way to Kaiboy hospitals, are they automated? Governor, a meeting, I thought it's a yes or no, and which company is doing the collection? I thought that was a very fair question. And another question was why you are missing your targets in terms of revenue collection. And then number three, Chair, because we are on budget performance and control, is on the issue of priority. My question, Governor, the reason I was giving an examples of your own audit, and I know you are fund manager, is I was asking, do we need to spend in your own financial statements, which is not generated by the Senate or OAG, do we need a priority of 13.1 million as opposed to 26 million that we are using to buy drugs? And then finally, Chair, Governor, the committee can write and request for details on those line-by-line budget. So, Governor, you are arguing before this committee in Article 229, Parliament shall consider reports from OAG. Then, Governor, why should we have this meeting if you can write to appear before this committee? Because if we cannot ask clarification in process to process our audit reports that will be tabled, then why should we have a meeting? Is it necessary? So if you can answer the 4 questions on the budget line, the committee can write, then you can respond. But can you respond on the issue of collection of revenue, the target that you have missed, the issue of priority, and the issue of the automation? And I ask a very basic question. You and me know that, and Chair, it is on record, and it is on the audit report of 23-24, that you have most of your stalled projects are linked to hospitals. And I was asking, could it be the reason that mother and baby in Cpic is yet to be finished? Buja is yet to be finished. Kapsengere is yet to be finished. Chepterwai is yet to be finished. And it is in the audit report, which is part of this consideration. And I was asking, could it be and therefore affecting the budget performance, which is part budget is not an audit query is misleading this committee, because one of the, can he answer the questions, or if he doesn't want to answer, we can leave it at that.
Your point is well noted, Senator. Your point is well noted.
And I play the importance of appearing before the Senate. But also, but I think for effective utilization of the time, the order has been that then you come and respond to audit queries. And that is my simple thing. I'm not saying that what he's asking is not, but get a forum for us to discuss those ones so that we have those details.
The report.
Yeah. Let him finish.
Unless the governor, sorry, Chair, unless I didn't get him right. Chair, I'm active listener.
I don't want
and I think governor is taking this meeting casually. Because the questions I'm raising, to be fair, even members here, is I'm asking valid automated. Does it need a literature explanation, Chair?
Okay, let me direct this.
Yeah.
We have our the query on budget control and performance, and the senator is trying to relate this to what he has pointed out, and then draw a parallel with that query of budget time on this back and forth.
With fiscal analyst, what is the revenue potential of Nandi?
That is a report on the year 2022, 3 million. That is based on that report. However, as a county specific, based on their target for the year under review, the target was 558. Appropriation is around 55. Thank you, Chair.
That is the reason, Chair, because even when you look at overall all source revenue, they are still missing the target, just the. And maybe, Chair, so that we close that question. So does it mean Governor will not answer my questions?
No, I think what the governor is he had prepared to respond.
Let's ask, is our systems automated? Does it need to prepare? It is something basic. It's simple.
Okay, let us allow him.
Chair, we can write a whole letter, and then he can come
and then we move because
so. One to the issues that touch on our appearance here. That 2 consultancy services, we Cpic, we do not have, radiologists and certain other consultants that we have for them to provide those services. So we have those categories of specialists that we do not have, that we have to outsource their services. In terms of the projects, the various projects that are ongoing within the county, FIF is not financing, the various infrastructure projects that are ongoing. They are being supported or they are being funded by the county budget. FIF largely targets the resources that are being raised within, and the same money goes to the services and goes to supporting the continuity of those services. So are being funded by this. Chair, in terms of prioritization and budget.
I think, Chair, the governor did not get me very well with a lot of infrastructure. I was saying this matters has been raised, and I was trying to tie up that could it be the reason you are missing revenue target by 41% in collection of revenue within the health facilities, performance of collection of revenue within the health facilities within Nandi?
No, it does not.
Just my simple question.
It does not.
Okay.
Is it further and give us a report as a committee? Senator Mudama?
No, Chair, because you have ruled, I think I hear the frustrations of the letter. Can write back with the answers. Thank you.
Oh, me. That report, then we can write to the governor. Thank you, Chair. Good afternoon, members. Good afternoon, Governor and your team. My name is Senator Chimera, Senator from Kwale County, member of this committee. Maybe before we end, we have a last query there, which members thought that they just need some direction from the governor on what the county is doing to address it. Lack of an internal audit function and audit committee for this fund. Governor, maybe you can tell us more.
So, Chair, the internal audit was affected by a staff audit process that was ongoing in Nandi County, and we are saying that that having the county, but also all the funds under being run by the county, but also all the funds under being run by the county government, and therefore being run by the county government, and therefore we are in
the governor may need to have internal audit function in each hospital.